Alive and Well STL is a presentation of the St. Louis Regional Health Commission with the first decade review of health status report to build a healthier St. Louis, and RareGem Productions. Power up with the positive. Learn more at oneraregem.com. That's ONERAREGEM.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network.
Today we're talking about life and living with HIV AIDS.
I think we have to get over this taboo, especially in Black church, that we don't want to talk about sexual issues. We don't want to talk about sexuality. We don't want to talk about any of those things that our young people and some of our older people are still struggling with. And so some of them hide. For some of them, it's the stigma of, if I come out, I'm going to be classified a certain way, I'm going to be looked at differently, and I'm going to lose the only circle of love that I have.
We will be talking about this disease and the way that HIV AIDS, the affected population, and the larger community have evolved over the last few decades. We'll be right back.
RareGem Productions, proudly presenting, promoting, and producing positive programs.
So let's start off. Pastor and Cheryl, please, as your introduction, share with us, what does it mean to you to be alive and well in STL?
For me, alive and well in STL is that I have access to health care. I can enroll in insurance programs, and I can use prevention opposed to just being sick and then getting care. I can be preventive. I can play with my dogs. That's the best of all. And I can look out across Forest Park and see the sun come up.
Well, Bethany, for me, what it means to be alive and well is to live abundantly. That's a scriptural reference, but it is an all-encompassing reference. It means that I have my optimal health. It means that I have my optimal wealth. It means that my health encompasses more than my physical activity, but my mental health, my emotional health, my spiritual health. To live and alive and well is to live my best self. I think that's all I want to say about it.
I wish I'd said that.
And you said enough. Thank you for sharing. That's a beautiful vision of health for you and for our community.
Alive and Well STL.
Good morning, St. Louis. Thank you for joining us today. I'm Bethany Johnson, CEO of the St. Louis Integrated Health Network and host of Alive and Well STL, sponsored by the St. Louis Regional Health Commission. Today in the studio, I'm excited to be speaking with Cheryl Oliver, Executive Director of St. Louis Effort for AIDS, and Reverend Traci Blackmon, Pastor of Christ the King United Church of Christ. Thank you both for joining us.
Thank you.
Thank you. There's a recent report released by the St. Louis Regional Health Commission, which is a 10-year look back at the changes in our community's health. And one of the topics that we want to highlight on the show this morning is the topic of HIV AIDS. So let's jump in. Cheryl, to get us started, what population does St. Louis Effort for AIDS serve, and what services do you provide?
We serve mostly the LGBT community, which is the lesbian, bisexual, transgender, and gay community. And we also serve anyone who's at high risk of getting or being infected with an STI, sexually transmitted infection. We do testing, prevention education, and comprehensive support services for anyone that's affected, not just infected, but affected by the disease.
So in our region, who is affected by the disease? Tell us more about the statistics.
The latest statistics, 2012 statistics, were that there were 5,842 people living with HIV in our region. There are a lot of health disparities that go with HIV AIDS, and unfortunately, about 54% of the population living with the disease right now in our region are African American, and predominantly men, and predominantly gay men. But we also have women who have HIV, and we have heterosexuals that have HIV, and we have almost everybody that could have HIV. We just want to be careful that they don't.
So in examining the disease, or the way we thought about the disease 30 years ago and how we think about it or how it's changed now, can either of you talk a little bit about that evolution?
A lot has changed from 30 years ago. I think that this disease, ironically, it's an incredible example of what can happen if a lot of resources are put towards something, because the combination of the Ryan White funding from the government to really make sure that services are provided medical care and medications, the biggest changes in the medications for people who 30 years ago, HIV was a death sentence. Today, it is a manageable disease if you manage it.
I would add to that by saying that the change for me is that we as a community have gone from dying with the disease to living with the disease. That's a wonderful progression, but one that we have to be careful with, because in that transition, there have also, I've noticed, attitudinal changes about the disease. And so because now you can live with it, we're getting more careless about it and more reckless about our sexual health and our sexual protection because it's not the death sentence that it once was.
So what are your biggest concerns right now in 2014 about HIV/AIDS population?
I have many. I've seen an increase in the number of people who come to me personally about HIV and AIDS. I find as a pastor, I learned this a long time ago and it's proven true, that people understand better what you preach about in terms of what you believe by what you pray about and what you study. And so I have deliberately and strategically placed in my study books that concern taboo topics, and they're at eye level. So when you sit in my office to talk with me, you can glance in my bookshelf and you know what's important to me. There are books there about HIV and other health crises and sexuality. And so because I do that and because I pray openly about these things, I get people not just from my church, but from other places who consider me a safe source to come to. So there's an increase in the number of people, young people, mostly African-American males who come, but also women. So that's one change that I see. The other change I see is in regard to the casualness with which we regard sex, especially among my young people. I don't know where this idea comes from that sex is only penetration, vaginal penetration or anal penetration. They don't consider oral sex to be sex. And there's a promiscuity. I hate to use that word, but that's the only word I have. There's a promiscuity that I think is dangerous health-wise, and it's also dangerous spiritually and emotionally.
Do you have a reaction or response to
I agree.
Concerns?
I think a very astute way of expressing some of the concerns that I have, the concerns that we have at the agency. I'll add to that in that a lot of young people think, well, all I have to do is take a pill, so it doesn't matter. I can get this disease and I can just take a pill. And it isn't that easy. First of all, the pills, they have a strong toxic effect on the body over time, and they're expensive. So if you don't have insurance or you're not in the Ryan White system, they're very expensive. A bigger concern that we have after years of evidence is that so many people who are diagnosed with HIV or AIDS are not in care. Well, over 50% in our region are not in care. So they're out there, they know. And then there's another 20% that the CDC says doesn't even know that they have it. They're living with it. That's a whole other story. But the 50% that aren't in care are living less healthy lives for themselves, and they're exposing other people at greater risk of getting infected. If you're in care and on medications, you're 96% less likely to infect someone else. What's the barrier? There are a lot of barriers. Probably Reverend could speak to them very, very profoundly. I think the barriers we see are obviously still stigma. It just doesn't go away. Our building has no signage on it, and we don't put out brochures that say HIV AIDS because people won't even pick them up. So there's still so much stigma that's out there. But if people do get into care and get on treatment, they can live relatively healthy lives, depending on if they have a lot of other issues. And there are a lot of other issues that go with HIV/AIDS. Substance abuse, homelessness, mental health. There's a whole family of things that goes together. And I think as a region, we could look more closely at combining how we approach those things. We're still very segmented. And I think what the Regional Health Commission has done and the Integrated Health Network has been really helpful.
Of course, I'm glad to hear that. Thank you. So, Pastor Blackmon, as you work in your congregation in the community, what myths exist that you think we need to address?
Congregationally, I think we need to stop lying to ourselves and saying people aren't having sex. People are having sex. We are sexual beings, and people are having sex. So can we teach abstinence? Absolutely. But can we continue to ignore the fact that people are having sex at younger and younger ages? People are having sex with multiple partners. If we don't have these conversations in healthy ways, then how are our young people and some of our older people going to develop healthy habits and healthy self-images? I agree 100% that the stigma is a big problem. Recently this year, like I said, maybe I didn't say, but I've had 2 people come to me to disclose that they're HIV positive. They didn't find out because they went to find out, neither one of them. They went because they thought they had the flu and they had HIV. And what am I supposed to do now? And so they call, and this integrated network that we're talking about, I know that yours is formalized, but I had to develop my own network. And so I have 5 who I call sister girls who work at different agencies. And I'm able to put them on an email together with whomever comes to my office and say, this person needs your help. And I choose them because they maintain confidentiality, because they're trained in that field, because they know how to link them into resources, and it works wonderfully. They're all from different agencies. I don't know who gets whom, and I don't really care. And then I provide, to the best of my ability, spiritual support for that person. I think we have to get over this taboo, especially in Black church, that we don't want to talk about sexual issues. We don't want to talk about sexuality. We don't want to talk about any of those things that our young people and some of our older people are still struggling with. And so some of them hide. For some of them, it's the stigma of, if I come out, I'm going to be classified a certain way, I'm going to be looked at differently, and I'm going to lose the only circle of love that I have.
Well, we've heard a lot of actionable things that we can do today. We can talk about it. We can say the word sex. We can form networks. We can find trusted partners and people. There are people that care. We can have optimism. We can live and thrive. There's a lot of things that we can do. So thank you, everyone, for joining us for another episode of Alive and Well STL. We want to hear from you. So please speak up and begin to share your story. Talk with your congregation, post it on our blog. Give us a call, 314-333-8369. For more information about today's program and services available in the community, please visit us online at aliveandwellstl.com. We will be back next week. Thanks for listening.
Alive and Well STL. Thank you for joining us today. For resources available, go to aliveandwellstl.com. If you have more questions about the program, need help, or want to connect, please call the message box at 314-333-8369. The Regional Health Commission with Chief Executive Officer Robert Friend Jr. committed to providing a detailed review of change over the past decade and 14 leading health indicators for the city and county of St. Louis. The first decade review of health status report, an update to building a healthier St. Louis. Discover the narrative, the data, and celebrate the progress already made to improve healthcare access and reduce health disparities in our region. Learn more at stlrhc.org. Alive and Well STL is another positive production of RareGem Productions. Thanks for listening.